In the prior videos of this series, we've looked at helpful blood clots, how these clots form in response to injury, and how these clots are replaced by scar tissue in the natural healing process. We've also looked at harmful blood clots, and in particular what naturally happens to these clots after they form. In this video, we'll consider the different circumstances that may contribute to the formation of harmful blood clots. Although the author of this video has experienced thrombosis firsthand, the author has no medical training and is not a doctor. Statements herein may not be accurate, complete, or appropriate and should not be relied upon when making medical decisions. Consult your physician without delay when making medical decisions. When medical authors explain unexpected clot formation, they very often refer to a concept called Virchow's Triad. Virchow's Triad is a three-part idea named after the German physician Rudolf Virchow, who practiced medicine in the mid to late 1800s. According to this concept, clot formation is promoted by three influences: changes in the lining of the blood vessel wall, changes in the flow of blood, and changes in the blood itself. These three elements, especially when they occur in combination, are thought to raise the likelihood of setting off the chain of events that leads to clot formation. One element of Virchow's Triad is changes in the vessel wall, or more precisely, changes in the lining of the blood vessel wall. Normally, the entire inside surface of the circulatory system is covered by a very thin lining of cells called endothelial cells. Any surface that comes into contact with the circulating blood, that would be the inner surfaces of the arteries, veins, capillaries, and the heart, are all normally covered with this thin layer of cells. In the blood vessels, this layer of cells is called the endothelium. In the heart, it may be referred to as the endocardium. The endothelium serves as a barrier that protects the blood from coming into contact with tissues located underneath the endothelium. These tissues contain collagen, a material to which platelets quickly adhere, and tissue factor, which helps to initiate fibrin formation. In addition to its functioning as a barrier, the endothelium continually secretes chemicals which help to keep platelets from aggregating and adhering. So when endothelial cells are absent or dysfunctional, such that they are not producing protective chemicals, platelets are more likely to adhere to the vessel wall and become activated. For example, atherosclerosis is a condition resulting in the formation of cholesterol-laden plaques within the vessel walls of arteries. Damage to the endothelium is thought to contribute to the slow formation of these plaques by means of risk factors like elevated unhealthy cholesterol levels, high blood pressure, smoking, and diabetes. Damage may also occur if one of these plaques ruptures, tearing the endothelium and exposing the blood to collagen and tissue factor from within the plaque. Another circumstance that may cause damage to the endothelium is prolonged turbulent blood flow within a vessel. Turbulence is usually more of a problem in the arteries where blood flows under greater pressure than in the veins. If an artery somehow becomes constricted, as may be the case when an atherosclerotic plaque begins to expand into the vessel opening, the blood flow through the constriction accelerates and becomes rough. This rough flow against the vessel wall is thought to, over time, damage the endothelium. Endothelial damage may also be due to trauma, such as a car accident, damage from IV catheters, surgery, or cancer therapies like chemo and radiation. So this is what is meant by changes in the vessel wall: the absence, injury, or dysfunction of the protective endothelium. Another element of Virchow's Triad is changes in the flow of blood. Changes in the flow of blood refers to the idea of stasis, slower than normal blood flow, reduced blood velocity to the point where blood may stand still or be motionless. Normally, blood flows through the circulatory system without stopping for any significant amount of time. But when blood flow becomes slow or even stops, clots may be more likely to form. Why? Because slow blood flow allows platelets prolonged contact with the vessel wall, bringing greater opportunity for adhesion and activation. In addition, one of the body's main defenses against this solidification of blood is the dilution of activated clotting factors in any particular area of the vessel by the continual flow of blood through that area. When blood stagnates, however, activated clotting factors may accumulate and enhance the possibility of thrombus formation. Slow blood flow may also hinder the delivery of the body's natural clot-limiting chemicals, which are released as part of the body's anticoagulation or fibrinolysis regulatory mechanisms. Slow blood flow may be due to poor heart function, as might occur with a condition like congestive heart failure. Stasis may also be the result of immobility due to things like hospitalization, bed rest during pregnancy, extended air travel, paralysis, or sedimentary lifestyle. And finally, slow blood flow may be the result of conditions that increase the blood's viscosity, its thickness, its resistance to flow. These hyperviscous conditions include blood diseases where too many blood cells are produced in relation to the liquid volume of the plasma. Low oxygen states may also induce a higher ratio of red blood cells to plasma volume, making the blood thicker. Living or training at high altitude and heart or lung disease can be examples of low oxygen conditions. Medications like anabolic steroids or EPO may also increase the viscosity of the blood by stimulating the production of red blood cells. And lastly, dehydration may cause blood to become more viscous by decreasing the volume of plasma in relation to the blood cells, as fluids are expelled from the body and inadequately replaced. A final element of Virchow's triad is changes in the blood itself, that is, changes in the components or constituents that make up the blood. The blood is composed of red blood cells, white blood cells, platelets, and plasma, as well as a number of chemical substances like plasma proteins, electrolytes, gases, nutrients, and waste products, all carried along by the blood plasma. This element of Virchow's triad refers to changes in these components that cause the blood to become overly ready to coagulate, in other words, to have a high propensity to coagulate. When the blood is overly ready to coagulate, the blood is said to be hypercoagulable, and the conditions associated with hypercoagulable blood may be referred to as thrombophilia. For example, some of the inherited conditions that may result in hypercoagulable blood are due to deficient quantities of the body's natural anticoagulants. Another is due to the overproduction of one of the body's clotting factors, caused by an abnormal gene. And yet another is due to the production of a variant form of a natural clotting factor, such that the control mechanism that usually neutralizes this factor is no longer as effective. And finally, a gene mutation may result in moderately increased blood levels of homocysteine, a substance that's been linked to both atherosclerosis and thrombosis. In addition to the inherited conditions that make the blood hypercoagulable, there are also other non-inherited conditions. For example, certain activities of the immune system may cause hypercoagulability. These activities may or may not occur in conjunction with autoimmune diseases like lupus. Due to the effect of estrogen, the use of some oral contraceptives, hormone replacement therapy, and even pregnancy itself may increase the likelihood of thrombosis. Some types of cancers release chemicals which cause the blood to become more coagulable. Cigarette smoking is thought to make the platelets more sticky, and advanced age is thought to increase platelet aggregation. What's been presented here with regard to changes in the blood is just a small fraction of the circumstances that may affect the coagulability of the blood. Fortunately, there are doctors called hematologists who are specially trained to discern problems with the blood that may lead to thrombosis. To sum up then, the circumstances contributing to harmful clot formation can be thought of in terms of Virchow's triad. Damage to the endothelium, meaning the absence, injury, or dysfunction of the protective endothelial lining of the blood vessel wall. Disruption of the normal pattern of blood flow, meaning slower than normal blood flow. And finally, changes in the makeup of the blood, meaning abnormalities in the components of the blood which result in blood that is prone to coagulation. These elements of Virchow's triad, especially in combination, may lead to the formation of harmful blood clots.